My name is Dr. Valerie Crabtree. I am a pediatric psychologist and certified in behavioral sleep medicine. I am the only pediatric psychologist in the state of Tennessee to have that certification. I have the distinct privilege of being asked to speak to the School Start Times Committee, which I very much appreciated. We had a really nice discussion, and so I'm going to try to summarize that hour-long presentation and hour-long Q&A into 6 minutes. So what I wanted to speak about is kind of the thought behind this idea of the delayed circadian rhythm in adolescents. So you've heard a lot of talk about kids not being able to fall asleep, and it's not enough sleep to get up so early for school. And one of the things that I think is a significant myth about teenagers not falling asleep early enough is this idea that they're just on their phones, and that's why they're not falling asleep. Now, if they're on their phones, they're not going to fall asleep, and that is true. But there was some fascinating research done back in the 1980s by a woman by the name of Mary Carskadden, who is just a pioneer in the field of pediatric sleep and circadian rhythm. And at the time, back in the 80s, obviously we didn't have iPhones, but there were TVs and social activities, and people were noticing that teenagers weren't going to bed on time and were hard to get up in the morning and then sleeping late on the weekends. And there was this idea that they're just too social and they won't do it. So what she decided to do was bring them in for what they called sleep camp in the summer. And they would bring them into an environment where there were no exterior cues of what time of day it was. So they didn't have windows, they didn't have clocks. And the kids were allowed to sleep when they want and be awake when they want and eat when they want. And they just wanted to observe what's kind of the natural rhythm of an adolescent. And what they found was it wasn't related to the age of the child, it was related very specifically to when puberty started. So prior to puberty, most kids were falling asleep somewhere between 8 and 9 and sleeping typically 9 to 10 hours at night. As soon as puberty started, that natural rhythm became delayed by 2 hours, 3 hours on average. So what we were finding is that even in the absence of these stimulating activities in the evening, a pubertal adolescent just could not fall asleep at the same time as a child prior to the start of puberty. So this study has been replicated time and time again. It's been replicated in other mammals that puberty shifts that circadian rhythm. So the problem that we bump into with these very early and unhealthy start times is that for the typical adolescent, they're generally not going to be falling asleep once puberty has started until close to 11 o'clock at night. For a school that starts at 7 a.m., many of those kids, depending on where they live and what the bus routes are, they may need to be out at the bus stop at 6:08, at 6:02, sometimes 5:50. Now, if you think about a kid who needs to get up and actually do something in the morning, like brush their hair or their teeth, that means that very often they're waking up at 5:30 a.m. So if we have a kid who hasn't fallen asleep until 11, and now they're up at 5:30, and they're expected to get to school and be functioning at their cognitive peak by 7 a.m., when that melatonin has not even been completely excreted from their brain. So they have a sleep-promoting hormone still circulating at a time that they're supposed to be learning AP biology. They have a sleep-promoting hormone circulating at a time when they are driving, as Kathy was just describing. And they're driving when it's dark, and they're driving as an inexperienced driver, and it creates a very dangerous situation. We then think to what happens later on in the day, and we have a child who's chronically sleep deprived because they're sleeping 6.5 hours a night, night after night after night, when most adolescents, because their brain is still developing, because their body is still growing, really require about 9 hours of sleep. So they're at 2.5 hours of sleep deprivation over the course of a week. We're talking about more than 10 hours of less sleep than they should be getting. That has a cumulative effect over time. So they may seem okay throughout the day, but then be increasingly sleepy after lunch. They may be increasingly sleepy after school. And we then are in a situation where they get home from school at 2:30 and may have parents not arrive home until 6 p.m. So then we also have adolescents with developing brains and frontal lobes that haven't completely formed, who are risk takers by nature, who may be increasingly engaging in risky behaviors because they're sleep deprived, and they're also unsupervised, which is a very dangerous combination. So I know that we have other speakers who are going to speak to depression, anxiety, suicide risk, but I wanted to give the picture of the science that underlies these recommendations by the Centers for Disease Control, the American Academy of Pediatrics, and the American Medical Association. And I think, as others have said, change is extremely difficult. As a psychologist, I know that. That's what I do every day, is help people change when that's a difficult thing to do. But we also know if we're going to have a guiding principle in how we make decisions for our children, I would hope that it is our Centers for Disease Control who help guide us in our vaccine schedules and our hand washing guidelines, and really are the voice of authority in terms of health promotion in our country, that we would be following that as opposed to some of the difficulties in making some significant changes. So I appreciate you all's time. I have a letter that I'd like to leave. Is there? I've got you, Mr. Jones. Thank you.